You're live. Hi, Dr. Suresh here, and Dr. Kapoor is there. So I think we can start. And we are live on YouTube, and this is being recorded as well. So welcome everyone. Good evening once again.
Good evening, Dr. Nitesh. Good evening.
Hi, sir.
Dr. Nitesh.
Yes. So today we are having one of the excellent speaker and one of the expert in the field of child custody disputes and parental alienation. And for the followers, you'll be aware of that. We'll be connected very serious webinar. We are called the experts from various domains, from law, and who have been working with parental alienation, pediatricians, psychiatrists, child psychiatrists. And today's guest is quite special because she has worked, she has published, she has dealt with parental alienation, and she's still dealing with child custody issues. And Dr. Priyanka Nambiar, she has done her MPhil and PhD. PhD is done in Niemann's psychiatric social work, and right now she's working as assistant professor in the Department of Social Work from Christ University from Bangalore. And I have listened to a lecture previously from another series of webinar conducted by MSW people, and it's quite unique and quite superb. And I want this information to be conveyed and be recorded so that it be useful for quite a lot of parents and even anyone who want to get more contents on how to deal with parental alienation. And welcome to Priyanka. Thanks for joining us. You can share your slides.
Thank you, sir. I'll just share my slides.
We have this video series as a part of IAP, ICANCL, part of the webinar. That is called as Indian Academy of Pediatrics. And they approved the ICANCL segment. It's called as Indian Child Abuse, Child Neglect and Labor. So it's quite unique. We are getting the recognition, and it is being done in collaboration with IAP Trichy and the Trichy Psychiatric Society also, along with Children of Divorce and Ayush Help Organization. Thank you, Krista.
Thank you, Dr. Nitesh. My slides are visible.
Yeah, it's visible and audible. Please.
Okay. All right. So, very late evening, good evening, dear doctors. And I am not a medical doctor, I'm a psychiatric social worker. So, here, I think the objective of the session would be to sensitize and orient you to the various dynamics and some of the key elements that we need to look into when we are seeing children who are from families with parents who are separated, going through a divorce case, because we have to be mindful that there could be certain special issues that may pop up while we do our evaluation. Why I say this is before my PhD on this topic started, while I was doing my MPhil and NIMHANS, it so happened that we got one child who came to the OPD with a mother, and this girl child alleged that the father had sexually abused her, right? And then hello. Yeah.
Sorry,
So
please,
then, yeah, when we admitted, so we had to admit that mother and child. And as we evaluated, a very peculiar sort of language was used by this young child, which was not age appropriate, right? She used words like personality disorder and many other things. And the rationale she gave to hate her father was because he used to wake her up so that she is not late to school, and he used to buy her too many chocolates, and chocolates are bad for your health, and he's trying to harm me. So these sort of very irrational explanations for hating one's parent was something very unique, and then we couldn't really understand. However, we admitted, and upon further evaluation during IP care over the next 2 to 3 weeks, we realized that mother had mental illness, right? She was diagnosed with mental illness, and she was in fact tutoring this child and brainwashing this child against the father. And then later we got to know that this could be a case of parental alienation. That's when it sparked our interest to understand that we shouldn't look at cases just on face value. We must dwell deeper to understand, are there any other family dynamics that could lead to such false allegations. And while I also say this was a false allegation, I don't mean to say that all such allegations are false. Of course, we need to always admit and evaluate Admit why? Because if the offender, if the alleged offender is a parent, we have to admit the child and ensure the safety of the child against the alleged perpetrator, unless we are able to prove there is a false allegation. So with that, that is when we all started to look into child custody as a special issue in child mental health that would have certain implications. So with that, let's just start understanding how do we safeguard child mental health and child custody disputes. So a little background is that divorce has become a very common contemporary urban phenomenon, particularly Maharashtra is having the highest rates of divorce and followed by Karnataka. So child's maladjustment to divorce, people often think that child is going to be detrimentally affected by divorce. On the contrary, what studies have proved that if two parents are living in the household and constantly, engaging in altercations, there is a lot of violence in the household. That is detrimental to the child's mental health. But if a divorce, through divorce, two parents can be supportive and nurturing and co-parenting the child, then that will lead to the child's better adjustment to divorce. But what we see in these child custody disputes, so just to, because all of you are medical doctors, just to help you understand, when a couple goes to the court and files for a divorce, that is called as a MC case, matrimonial case, MC, and there'll be some number attached to it. After the MC case is filed, the parent, if the couple has a child, within the MC case, you can choose to compromise and figure out a custody arrangement if they are willing to. So within that MC itself, there'll be many other subheadings, alimony and child support and whatever, whatever. They're able to sort it out within the MC case. Hence, there is no additional case filed. But many of these cases, because of various, ego-related clashes, etc., one of the parents chooses not to give the custody to the other parent. And that leads to either of the parent to file for a GNWC case. GNWC is Guards and Guardians Act, right? So under the GNWC case, that becomes a separate custody case, not an MC case, a separate custody case. So my PhD was on these children who were involved in this GNWC case, which means that the level of acrimony and animosity toward between the parents was really high, very high degree. And here the child is used as a pawn to meet the parents' best interest. It can be used for getting more, alimony. Could be used for child support. It could be just used to, as a vengeance against the other parent. The child is just used as a pawn here, and clearly in the vested interest of the parents. So the ethical dilemma often that puts us mental health professionals that who are we serving? So when the court sends a family to us, right, are we serving the court by merely observing the couple and the parental dynamics and the parent-child interactions and sending to the court, or are we going to do further, little more for the child? Right. So because in India there are no specific, child custody evaluators, there are no key defined roles. So if I am evaluating the child for the custody, I may also be the therapist of the child, which is not in the best interest. So these are certain ethical dilemmas are also playing the background, and hence child custody has become a very complex issue, especially in the forensic field. So to understand what is child custody evaluation, so over my during my PhD study, the aim of it was there were three parts to my study. The first one was mostly quantitative, where I looked at predictors of emotional behavioral issues in these children. Then the second part was I was trying to understand from the stakeholders, from lawyers, from mental health professionals, and from parents, what are the mental health issues faced by these children. And the last and most important part of my data, which has not yet been published, is the lived experience of these children. So, in the lived experiences of the children that I studied through a phenomenological uh, approach, is that what they were saying is how the court was a very child unfriendly place, very scary place to be. But they were asked all sorts of inappropriate questions like, do you get scared looking at your father? Very suggestive questions. The lawyers used to ask them. There were many bystanders, many onlookers who were strangers. Basically, they were just in the hallway and they could see the child in court and standing on the court stand, which was a very uncomfortable experience. And in the court, the child used to face many other issues like the other parent used to try and pull the child, push the child, sometimes in the court, sometimes in the police station. And also like very trivial things that other children take for granted, like attending birthday parties or going to picnics. For these children, it became, an agenda, like even more difficult than a bill to be passed in the parliament. They had to get approval of both the parents. And if one parent says, no, this was my Saturday, you had to come to my house, and you have to. You cannot attend your best friend's birthday party because this Saturday is my visitation day. So the child is being deprived of his or her childhood, right? Just because the parents couldn't sort it out. So in this particular scenario, what is lacking in India is something called as child custody evaluators or child custody evaluation process, which is nothing but a scientifically sound evaluation process. It will help the court determine which is the living arrangement and parenting plan that is best going to meet the needs of the child. So there are three, according to American Psychological Association, very long back, they came up with the PCE where they have said that there are three main things. First thing about child custody evaluation is we have to assess child's psychological and developmental needs. So an infant versus early childhood versus middle childhood versus teenager, right? Very different roles. The gender, right? And then many other elements that needs to be taken into account. Assessing parental capacities. It does not only mean monetary abilities. So even a parent who is not working, maybe the right parent. Do they have the time to spend with the child? If a parent has a mental illness, say depression, does that incapacitate the parent from being a good parent? Again, needs evaluation to understand their level of functional impairment in depression. So many of these aspects. And the last one is the determination of the best fit between child's needs and the parental capacity. So in order to serve the child's best interest. So this word best interest has been used very loosely and it is very confusing. So what happens sometimes in these courts with young children is that sometimes child will say, "Oh, I love my mother. I want to stay with my mummy. I don't like going to Papa. He's scary." That's it. So they take it as face value and say, "Oh, the child is scared of Papa. She wants to stay with mummy." Then when I dwell more to ask why is mummy better than Papa, he may say that no, mummy lets me eat chocolate at night, ice cream at night. So would that be in the best interest of the child? No, clearly not. As pediatricians, all of you know, so I don't think any pediatrician say, okay, let the child eat cold things at night. Say a young child, say a 6-year-old or 5-year-old, clearly not. You would advise not to use cold things or eat ice cream at night in winter. Maybe, I don't know, maybe you can refute, but in the general context. So this would not be the best interest, right? But if I had not asked some of these extra questions to understand, is the child getting, is because all the child's demands being met, right? Just to pacify the child, are the parents overindulgent? Are they highly permissive? Which in developmental or parenting standards is not in the best interest of the child, right? So permissive parenting is a big problem, right? It will lead to a lot of behavioral emotional issues in future because child will not be able to delay the, need to gratify, etc. So that would lead to anger outbursts, tantrums, etc. So yeah, clearly not in the best interest, right? So we need to look at what is the best interest in terms of the long-term interest of the child, not the immediate gratification. So there are multiple psychosocial problems within these families, especially sometimes the issue of parental termination may come into picture where some parent may have a personality disorder, substance abuse, or they may be incarcerated. So all of these issues need to be taken into consideration. Additionally, caution has to be taken to see that the best interest of the child is the principle that remains to be applied specifically in each case, right? So we have to do a detailed psychosocial evaluation. It becomes both indispensable and challenging. So some of the key areas that we look at when a judge passes a child custody order is that the agreement needs to be entered by the parents or whatever is the current status quo that could be applied. The wishes and the feelings of the minor child has to be taken into consideration. The age of the child. So in India, there's something called as the tender age doctrine in the GNWC, right, in the Family Court Act, where children below the age of 7 automatically are given to the mother for custody. And then later, there a certain reevaluation can happen at a later point to see if there could be some change in the custody. By custody, I mean that the primary custody will be the mother. The father can have visitation right, father can have weekend stay or alternative weekend, something like that. But the primary custodian, by custodian, there are two people involved. One is the custodial parent, and the other one is the parent with a visitation right, the non-custodial parent. So the custodial parent is the one who decides with school, right? If any medical interventions have to be given, the custodial parent has to sign. The school matters, the custodial parent has to sign, and the other parent has no such rights. So that is the difference. And in India, in one of my children that I've seen in the clinical setting, the child had two custodial parents. It was called a shared custody, right? So I'll also briefly touch upon that in my case vignette. So sometimes shared custody in foreign literature has said that it is good. Yes, it is good to have both parents as custodial, and you can go stay with either of the parents, and there is no such bar. But in this context of this particular child, it became highly detrimental. So I will put it up in my vignette to show. The ability of each parent to fulfill responsibilities will be looked into. Any welfare reports. So this is from Western literature where any report of domestic violence or substance, drunken drive, everything will go into the welfare reports, right? Um, so that has to be reviewed. In India, I don't know if there is such a comprehensive system where we can track all of these reports at one place, which, to my knowledge, it is not there, unless one of the lawyers dig deep and find. But as a system, we don't have that we can pull up. Violence and psychological pressure exercised by the parents. Parental responsibilities and access, child support, and other some assessments have to be done. As mental health professionals in child custody management, we play multiple roles. So as I said, in India, we are playing multiple roles. We are sometimes the expert witness where we only do the evaluation for the court. We observe the interaction patterns and submit a detailed report to give our inference on what was the interaction like and what does it mean in terms of parent-child dynamics. Or we could be a mental health evaluator where we evaluate the child using diagnostic assessment tools, etc. We could be just the therapist of the child. We could be, we could also consult attorneys and other rules. So, as a child custody evaluator, you have to have some basic legal understanding, not to the extent of a lawyer, but just basic understanding of the acts and what documents have to be set in place, etc. Definitely understanding of child development, child psychopathology, special issues that I will come into, family system, and also adult psychopathology. Of course, at NIMHANS, we have a child psychiatry center, Department of Child and Adolescent Psychiatry. We also have adult psychiatry, Department of Adult Psychiatry. So usually, if there's a court order, we used to refer. When I was working in NIMHANS, we do the evaluation of the child, and our parent will be referred to the adult psychiatry. So the child evaluation, custody evaluation steps. These are the key steps that we follow. The first one is the child's interview. Always we start by interviewing the child because we feel that everything must revolve around the child. If we start with the parent, clearly the power dynamic shifts, right? The child may infer that the parent has more capacity or more autonomy or more decision making power, right? So the child doesn't know really who we are, what we do. So we always start with the child. We let the child start, introduce us to the child as, we are here to understand what's going on in the family and we are here to help you out. So it's always child first. So we do a clinical interview and assessment. We apply skills. We have a detailed work of performer. So we used to do all of that. And then we understand, we also use some non-directive questions or activities to understand parental involvement and parental attachment. Uh, for one example of an activity is, I had a workbook for my PhD which said around the world, so world tour on a ship. That was my activity. The page was, I don't know if I don't have it now, so I'll also have shown it to you. So it is basically a ship and there are 6 seats, okay? So 4 seats on top, 2 seats down. The first of the 4 seats is the child, okay? So I'll say, this is you, right? And you got 5 more tickets, right? And you can go around the world on this cruise ship, right? On this luxury cruise ship. So who all will you take along with you? That's it. I mean, I didn't talk about mommy, papa, friends, grandmother, nothing. It was an open-ended, non-directive question about a cruise ship and child would have a lot of fun. So we want to see who all will the child place, who will be the first person sitting right next to him. The distance between the child and the seats. What is the order of these people coming into, the seats, right? So first he will say, oh, I want to make mama sit next to me. And then he may also say, I want my pet dog to sit with me. I had a child who never mentioned any of the parents. They straight away went to the grandparents, right? So, then you'll see really interesting dynamics. And after the child writes that down on the chairs, who will sit where, then I start by asking, okay, how do you spend time with this person? Can you tell me more about what you do with him, her? And you see how the flow happens. So it's always non-directive questions, never suggestive, right? So we use a lot of these techniques to evaluate. So just one example, but such examples, many such techniques are used to evaluate and interview the child. Again, if it's a younger child, for an older child, yes, we can be more direct. But in many cases, older children don't come to us because often they are they're able to articulate, and the judges really don't need our assistance to understand. 15 plus children, but younger than 15, such methods are useful. The second interview, I mean, it's not per second, it's done like first we start with the child, and then next session can be by the way the parent, then again we go back to the child. So, but we start out with the child, we kick it off with the child. So in the parent interviews, I will start by individually understanding, assessing the parents, their marital history, their psychosocial history, the parenting styles, etc. And then I will start with conjoined sessions between the parents to understand what are their concerns and if we can come to agreement during our conjoined session. And then we also do parent-child observation. So we have observing mother with child, what is the interaction. So we had, so this was my time at Nambiar where we had one-way mirror, we had play therapy room, and we could observe through the one-way mirror what the interaction is like with the father. Similarly, so to understand how when the child is left with this other parent, what are the kind of discussions they have, what is their distance. So all of these observations are made note of in our report in detail. Then the documents review. So if we have with us any legal or personal documents, so I already told you the welfare reports, so has there been history of domestic violence, any complaints from the school in terms of the school nurse identifying any bruise marks, malnourishment, etc., etc. I mean, I don't know in India if I mean, many schools may not adequately document, but in the West, clearly there is clear documentation and digitization. So then it's easy to track. But in India, that would be a challenge. But in the long run, this is the direction we want to go towards. Then any other collateral information, we'll also try to contact the teachers. If their child is having a therapist, we will discuss with the therapist with the permission of the parent. Any other, I mean, we've never, ideally at Niman, we haven't contacted neighbors or family physicians, but in the West, they are, because child custody evaluator has a legal capacity. They are appointed by the court. So they have that capacity to go and ask the neighbors and all the other collateral, get collateral information, but we don't have that. So hence we restrict ourselves to teachers and therapists. Last one is a detailed report writing. So these are the steps that generally a child custody evaluation must include. So now I'll be moving on to some of the special issues which I will discuss in detail. Before I start with the special issues, so far, is anyone wanting to ask anything? Maybe we can take a question and then I can explain the special issues. So far, is there anything that anyone would like to ask? Yeah. So if there is nothing else, then shall we continue? So shall I continue?
No, I have kept it muted. Just a minute.
Okay.
I'll unmute the chance with the mic for
Okay.
they can. Somebody is asking.
Okay.
Mr. Gold, just a minute. I'm just taking out the settings.
Sure.
Yeah, participants can unmute and ask. Mr. Gold, please, you can ask.
Good evening, Dr. Priyanka.
Yeah. Good evening.
Ma'am, I have a rudimentary question. My question is, as an expert, can you define what is violence? Initially, you were talking about a family dynamics where two couples are fighting and it would probably affect the psyche of the child. So could you explain what do you mean violence, please?
Yeah. So, I mean, so here by violence, I'm talking about the intimate partner violence that happens, right? Or it can also be the physical abuse on the child, right? So, in terms of punitive parenting, these are the two violences that I'm describing here. So, intimate partner violence is when two spouses fight. It could also extend to the other family members. So, domestic violence, as they call it, where suppose the father-in-law is beating up or verbally. So violence again, the abuse, there are three types: verbal, physical, and sexual, right? So it could be any of this, right? So I meant IPV, DV, and child abuse. So if the child is witnessing this on a day-to-day basis, that could entail violence.
I'm sorry, if I could elaborate. In a couple partner relationship, how do you define violence is a good question when it comes to legal terminologies and when it comes to an expert such as you. Now, if there is a family as such, there could be small twitters or small twitches between most families or all families. Now, what are the things that you categorize as violence which would affect the child's well being? Two couple fighting over probably a petty issue might not affect the child. However, two couples, physical abuse, no question about it. Sexual abuse, no question about it. But when it comes to a family dynamics, how do you define violence that would probably affect the psyche of the child? Was my broader question. I'm sorry.
Yeah, so basically violence is a behavior where you are, using physical force to hurt or damage or harm somebody, right? Here, what I told you about domestic, I mean PV, IPV, and the child abuse. But here, you talked about an interesting thing. What if parents are bickering, the couple is bickering over small things? It talks about the intensity and duration, right? What if it is an everyday phenomenon? If it's going to be every day and is it coming in the way of the child's well-being? So, for example, today the couples fight and then we have an argument and then they don't talk to each other. And today is the child's, say, basketball tournament, for example. So the afternoon, mommy, papa has fought, and now they're not turning up for my basketball tournament. Or now papa comes alone, mommy does not come. That's going to affect the child. So violence can be emotional in that sense, right? So here maybe nothing physical happened, but clearly the mother's absence because of the hostility between the parents, the subtle hostility or whatever the thing. But if it's on an everyday basis or very frequent, that is definitely affecting the child on everyday basis. So long-term impact would be there.
Thank you so much.
Yeah.
Yeah, ma'am, I'm Rajiv here. I have a question.
Yes, sir. Tell.
Yeah, ma'am, my question is that why this concept of parental alienation is not so well understood in India, and why it is not so well accepted by our society. In fact, even the judges, they are not so, so what you call so sensitive about this parental alienation. So what is your opinion on this, and how do we sensitize society in general?
Yeah, so the concept of parental alienation was brought about by a child psychiatrist, Richard Gardner. He talked about some 7 signs that would entail parental alienation, so unjustified rejection and manipulation, many other things, borrowed scenarios, etc. But I would not want to institutionalize this word parental alienation. Why? Because in India, we have to first start by having a child custody evaluator to do the basic steps of child custody evaluation. Because now what will happen is if I say there is something like parental alienation, which may exist, of course, but we need qualified people, a child psychologist, a social worker, and a psychiatrist to sit together in a multidisciplinary team and do these multiple rounds of evaluation like we do at, we used to do at NIMHANS. But how many NIMHANSs are there across the country is another question. So if I say that if a child rejects one parent, right, and this is parental alienation, if I label it like that, it's going to be a very dangerous situation where real instances of abuse may be construed as parental alienation, and the child may be sent back to the manipulator or back to the abusive parent. And real that parent would have been abusive, right? So it could be manipulated by lawyers in the court of law, right? If we institutionalize this word, right? So I don't want to mix parental alienation with child custody evaluation. This is one of the special issue. I'm calling it a special issue, but we cannot classify it as a syndrome. And I'm not. It is definitely something that we need to do detailed evaluation for in a multidisciplinary setting, and it cannot be just determined by the court based on how the lawyer is able to manipulate the judge on this. So this is why detailed understanding. So I have only published one paper from that paper. I got multiple questions, though we had true allegations, right? Some of the allegations were true, in fact, true, right? There was a father who was sexually abusing the daughter, and we had proved it. And that was not parental alienation, right? There was this one case I told you just now when I started the session. That was a case where the mother had mental illness and the mother manipulated the daughter. But had we said all such cases are false allegations, what would happen is the child may be, re-victimized by these perpetrators because the court will dismiss. It's just like what happened with domestic violence, right? It's a double-edged sword now. The DV Act was there to protect women, but what happened when women started misusing it? The real victims of DV are not getting justice because everyone is thinking that this is a false allegation. The women are just making up the stories, but the true victims are suffering. So the problem is, I'm not. Maybe I am probably as a early career person is not really in the position to say that parental alienation has to be brought in court. Rather, I would say we have to simply send a child who has come in the context of child custody to a mental health professional who is in a tertiary setting. A private practitioner cannot do this. In a tertiary setting, you have multidisciplinary team of a psychiatric social worker, a psychologist, and a psychiatrist, child psychiatrist, who can do detailed assessments and figure out what is in the best interest of the child. In the process of child custody, we may encounter, 10% or less than that cases where there are certain elements of parental alienation, which we can address. But it is just less than 10%. It is, I mean, this 10% is not something that is from a review of literature that I've come up with, but I'm currently doing a review of literature on this. Maybe I'll get an accurate number, but for now, I'm just assuming, but definitely less than 10% of the cases I have seen had parental alienation. So we don't want to keep that
but-
as.
Ma'am, sorry to interrupt. So, in your opinion, a mother or a father not allowing the parent not to meet the father, is it not a parental alienation? Which generally happens in most of the cases.
Right. That is not parental alienation unless the child is rejecting you. The father and mother not allowing is what is the adult is doing, that is the adult's action. Parental alienation when the child unjustifiable rejection of the other parent or denigration of the other parent by the child. So is the child not saying that I don't want to meet you, Papa? A child saying that you're a bad father, I hate you, I don't like you, I only love Mama, right? So is the child saying it? Then we have to evaluate, is this a phenomenon of parental alienation? But if the mother is like, no, I'll not give the phone to my daughter and slams the phone, it is not parental alienation because the mother is clearly depriving the other parent of access. No? I hope you understood the difference.
Yeah, okay, ma'am. Thanks. Thank you so
Child
much.
rejects the father and say, you're a very bad father, I hate you, and all of that. Then, and she refuses, the child refuses to meet the father, right, for reasons that is not understood adequately. There we could do an assessment to see is this a new phenomenon? How has the relationship been in the past? So we have to look at the past relationship, past involvement of the parent. Were there other instances of such rejections? Because there is a fine line between parental estrangement and parental alienation, right? So I may be genuinely estranged from my other parent because he or she was abusive or neglectful, and there was clear history, right? I was very pally and I love my dad till last week, and suddenly today I hate my father. That shift for no apparent reason, there, yes, we have to evaluate for parental alienation. That is a clear sign.
Okay, thank you, ma'am.
Okay.
Hello. Am I audible, madam?
Okay. Yes, sir.
Yes, I'm Dr. Arun Nagrik, and
Yes.
today only I had a date in the court, and I'm appearing in person in the court to fight this custody battle in case of parental alienation, madam. So I will briefly go through my scenario. My child is separated from me since 2020, and it is almost 6 years now. And in those 6 years, I have not been allowed to share a dining table or to spend a single night with my child. I have applied so many times in the court. I have complained to Prime Minister also. I have complained to President, Chief Justice of India, High Court judges, everywhere. Highest authority I tried. But what I have seen in this legal system that these judges are not at all trained to handle this kind of cases. Even the judge before this, he asked me what is parental alienation and he wrote the spelling of it. That person is going to decide my child custody when he is not at all aware about the parental alienation. And when I give application for my child for a birthday celebration, for overnight custody in Diwali or somewhere in summer vacation, they call the child and ask him whether you are ready to go with your father. Definitely, my child will say no because he is parroted. He is parroted, he is tutored. So when he says no, judge says your child is no, saying no, so you will be not get this overnight custody or whatever it may be. So it has created immense pressure and anxiety within me that my child is getting older with time and he is getting separated from me. As much as time passes, he will be detached from me emotionally. But neither the judge nor the advocates understand the situation. And because of this, I had to remove my advocate from my case, and I myself has to fight this case. And today, to note you that these parents who are victim of this alienation, parents, they face anxiety, they may be angry, afraid, or they may be anxious sometimes. And if we be present like this in the court, it becomes against us only, because we know that child is parroted and he is not, that no is not his own no, it is the parroted no which the mother has taught to him. But no one understands this. And last time, one article is there, parental alienation and suicide in men. You might have gone through that. That Gardner author, there is a sentence mentioned that it is like death to a father. My child is separated from 6 years, and you can imagine, not for a single day, not for a single night, I have having custody of my child. And in that scenario, or this, if the mother is narcissist, then you can imagine the intensity of abuse that child beyond his knowledge, the intensity of abuse that child is facing beyond his knowledge, and the abuse that father is facing. It's like I am seeing my child is drowning, but I am not able to save him. And I have requested for help, but everyone says, no, your child is not drowning. How to face this situation and how to handle this situation?
Dr. Anand, thank you for sharing such personal detail.
Hello?
Hello, Dr. Anand, can you hear me?
Yes, ma'am.
Thank you for sharing and understand. I mean,
Your voice is a little bit feeble.
yeah.
Everyone,
Can
can
you
you please?
Yeah, can you hear me now?
Yeah, now it's
Hello.
better. Yeah, it's better now.
Yeah. So thank you for sharing such personal information. And I have interacted with many such parents. Primarily, they were mostly fathers who were alienated. The challenge here, the problem, the primary problem here, I want to highlight is the 6 years, right? So this protracted child custody dispute is the main problem. And like I already highlighted, had your child's custody evaluation done right in the beginning, that's what even in my PhD thesis at the end we were putting down a recommendation. This is the must and foremost thing is that we need timely intervention with the child. The longer the child stays away from you,
See, what happens that I know that unless and until I react with this, I get time to spend with him, then and then only whatever may be the estrangement in his mind, those will
correct,
be elevated.
correct,
But
correct.
they don't give the opportunity to talk with
Yes.
the child. They don't give the opportunity to spend time with him. And I am not having a right to call also, right to video call, or right to call, or right to text. My number is blocked from my wife's mobile also, and from my child's mobile also. So how you are saying that we should try to make contact as much as possible, but how
No,
to
no, no.
execute that?
No, no. What I'm saying is that this is the flaw in the part of the legal system. Right. You cannot make contact if the other person is denying it. The other parent is not permitting. So it was supposed to be at the initial level from the legal system. They were supposed to appoint a child custody evaluator to do the steps I just showed you in the flow chart. Those steps had to be done, and a interim custody arrangement should have been formed in the first 6 months of the separation. Right? If the child is not willing to meet the other parent, in this case, is it a case of parental estrangement or case of parental alienation? That should also have been evaluated, but not after 6 years or 10 years. In the first six
See,
months. This
yes,
is the major flaw of the legal system, was what I wanted to highlight, and I also highlighted this in my thesis. That all of these cases became so problematic and so protracted where child had to repeatedly go to the court and answer very uncomfortable questions and had to be pulled and pushed in the courtroom, in the police station. That is because no child custody evaluation was done.
Hmm.
Right.
So
That
I
is
also I know that getting the child to the court or to the evaluator, it is itself traumatic to the child. But
yeah. Evaluation is not
apart
really traumatic. It is done
but
in a private
what
setting.
that
Yeah.
that
So sorry to interrupt.
what I have did is, yes, sir.
I just have one small clarification required here. So you mean to say doing this child custody evaluation as soon as there is a custody case filed,
Mm.
is that a good thing to do?
Yes. Yes, sir.
Before
Yes,
all
sir.
this alienation develops, as soon as the father
Mm.
and mother separate, the child starts living separate, immediately go for a custody evaluation. Is that what you suggest for to
Yes,
avoid
that's
such
what
issues?
I suggest, and that is what has clearly happened. So, the problem that has happened in all of these custody parental alienation contexts in the custody battle, that I will just show you one or two case vignettes due to paucity of time, is that there was a gap, right? So, the child will be with the mother, or in one case, the child was with the father. The father was denying access to the other parent continuously for like 6 months, 1 year, 2 years. Finally, after 2 years, to Supreme Court or somewhere, they send us the referral. After 2 years, so 2 years, child was cut off from the other parent. Child could have been manipulated, so the alienation process could have started. We don't know. And then after 2 years, you're bringing the child to, say, a center like Nimhans, and where there, clearly the child is refusing to meet the other parent. It took 2 years to do all of this, and they expect us to do, do all of this in 2 weeks, which is not possible. Rather than that, when the child was taken by this parent, father, okay, for example, in one hypothetical case, say the child was living with the mother for 9 years. So it's a case. Child was living with the mother for 9 years in a foreign country, right? Throughout 9 years, child lived only with the mother in a foreign country. She's a foreign citizen, actually. And she was happy. There were pictures of her birthday party, whatever. While in the foreign country, there was also a case of domestic IPV between the mother and father. It was also in document. So mother was the legal custodian. Father had divorced. Father remarried in India, but father didn't have another child from the remarriage. So after 9 years, the mother thought, okay, let the child go and visit the father. And he wanted to see, because he didn't have child of his own from the second marriage. He thought, okay, after 9 years, so child so far has never seen the father. Or, I mean, probably they've called on the phone. I don't remember the case. It's been like 5 years now. But yeah, so minimal interaction, maybe telephonic interactions. But for the last 1 year before her visit, father was regular calling and video calling. And the mother drops her from the airport and the father takes her. And for the next 1 month, father absconds with this child. Father and his second wife absconds with this child. They go and stay in multiple resorts and whatever. And finally, the mother comes to court and all of that. And after around 9 or 10 months, finally, when it went to the Supreme Court, so it was in the family court of Bangalore, then it went High Court of Bangalore, then it went to Supreme Court of Bangalore. Supreme Court had to order Nimhans to do a evaluation, right? So in this 10 months or 9 months, I can't remember the exact timeline, the child was completely brainwashed by the father against the mother who she lived all her life. That's what. So why did it take the court 10 months to refer this child? The court has all the power to summon anyone, right? I mean, I remember Nimal says, this summoners come tomorrow to court for something, we have to go. So why did it take 10 months to send this child? Now, 10 months of alienation, indoctrination by this father, the child has never lived, because now the father, indulges her with, a lot of fancy gifts, this and that. So a child of 9-year-old cannot really think beyond that. So much fun. I'm going to play every day and having these expensive gifts, whatever. So easy to manipulate such young children. So it took 10 months for referral, and we are supposed to undo all of that in 10 days is not possible. So this is what I'm saying, the delay. I mean, this is actually a less delay compared to the years that Arun sir talked about. But the problem I want to highlight here is not the alienating behavior by the parent. Yeah, of course, parents, it is just one of the phenomena studied by Richard Gardner. Okay. But there are more such things that parents do, many other devious things that adult parents do, right? You're aware. But the problem is, it is the duty of the court to safeguard the interests of the child. The child does not have a lawyer. Let me highlight it that the mother hires a lawyer, the father hires a lawyer, but who's representing the child? Nobody. Child is just a puppet. Whoever is currently having the child will use the child as a puppet. So here it is important for the court. The court must be the guardian of the child. The court must take immediate action to say, okay, let me refer this child. There's a lot of problems. Let's find out which is the best living arrangement for the child. Rather than waiting for 10 months, or in Arun sir's case, 6 years, right? It's not a small time. 6 years of deprivation, and the child will obviously say, no, I like to be with my mother, or whoever is a custodial parent, because children, hello? Hello?
Yes, ma'am, you're audible.
Oh, sorry, my
Yes, ma'am.
because children do not have autonomy, right? Children are dependent on the custodial parent, right? Whoever the child is living with, child is dependent on them, right? So clearly, you cannot expect a child to take this stance. The mother would have said many things. The mother would have said, "See, your father remarried. See, or I will go to jail if you say this. See, I don't have anyone, only you." I mean, I don't know. Or the mother may be giving expensive gifts to this child. We don't know. Any of these things, multiple ways, especially young children, can be easily manipulated. I mean, they can be manipulated by a stranger also. So
Ma'am,
what
one last.
it is
Yes.
definitely the court who needs to take action. Only the court has that power. And just to highlight some, the Kerala High Court have appointed principal family court counselors in all its family courts, and they are training them also in child custody evaluations. So even Maharashtra had done. I think hopefully Karnataka may start that soon. But Maharashtra was doing a lot of sensitization program for the judges. And so Nimhans, through their Samvad project, was doing a lot of sensitization.
Actually, what happens in this system over the period of these 2.5 years in the court where I am facing, in these 2.5 years, I am facing third judge. And when the first judge changes, the new judge, to understand the scenario and that intensity of this abuse, it takes almost 1 year again. And by the time he understands, he gets transferred. And the present judge, which is there in my matter, she herself is a narcissist. She even not allow me to utter a single word.
Dr. Arun,
What
like we'll
she said to me.
restrict this discussion.
Yeah,
If
Dr. Arun, maybe you can share my email. We can have
how to deal with this? How to deal this
One
kind of
last
situation?
question, ma'am, from the psychiatrists and psychologists. One very positive thing that came out today is that immediately go for this parental fitness evaluation as soon as a custody case is filed, so that let them evaluate before this alienation happens. Let the both parents be evaluated. Like that, do you have any recommended guidelines to assist the courts? Because the courts also are kind of clueless right now as to how to deal with this problem. You're very right in saying that it is the responsibility of the courts in the parents patriot jurisdiction, but they're also kind of blindfolded. So do you have any recommendation? Like, one very good thing you said is, the moment there is a custody case filed, go for the parental fitness evaluation within 30 days, and if both are fit, then maybe a course of action can be taken. So like that, do you have any concrete suggestions for the court system? That's my question.
No, in fact,
Yeah, it's a
like
good
I
question.
mentioned, through the Samvad project and Women's, we had written some recommendations for the Women and Child Development, Ministry of Women and Child Development, at the central level for protection of children, child custody disputes. But
How do we access? Kindly give that information. Thank you, ma'am.
yeah,
Sorry for
so
interrupting.
Yeah. So the thing is, like I said, it's we are still working on this. We are trying to, discuss with various stakeholders, and we don't miss an opportunity to discuss and sensitize judges about the need for child custody evaluation. And Dr. Arun, I would be, I mean, Dr. Nitesh can share my contact, my email ID with you, and we can have, discussion on this in little detail
Yes,
maybe
yes,
later.
definitely, madam.
Yeah,
Yes,
sorry to cut you
that is bit
short.
of my case
I just
actually.
quickly, I want to just quickly, just because time is up, but I want to just highlight some of these key issues. While parental alienation has been a topic of concern, I feel that all of this should be given equal weightage, right? Relocation, siblings being separated. So, they treat children like a piece of cake.
And
I
Priya,
think,
can you make it big?
oh, sorry. They, yeah. So they treat children like a piece of cake and the siblings. So I will take the son, you take the daughter. So there is clearly disregard for the siblings' wishes and wants.
We can see the PPT,
Remarrying
sir.
and repartnering. So when your parent remarries,
We can see the PPT.
hello.
We can't see the PPT.
Oh, sorry. 1 minute. I will just share. Can you see now, sir? Can you see now?
No, we can't see. We are
Oh,
unable to see.
okay. Now?
No.
No. Okay, I'll just close and I'll reshare. Yeah. Not sure what happened. 1 minute. Is it visible now? Is it
No.
visible?
Visible.
Oh, it's not visible.
Yeah.
No, madam, your skin is not visible.
Okay, I think I have to log out. Something has happened. I'll just.
We'll wait. We'll wait. We'll wait.
How do I leave this out? Can you make me the host, Dr. Nitesh? I will share. Uh, Dr. Nitesh, can you make me the host?
What do you want?
Can you make me the host? I'm not able to
Okay.
share.
Wait. Yeah. I think it's gone. Yes, please. Please.
Okay. Yes. Is it visible now?
It is coming and
No.
going. Maybe you can present without the full screen mode.
Yeah.
It
Is
is
it
not
visible now?
sadly no. You can just
Okay.
skip the
Maybe
PowerPoint.
Dr. Natish, I will just email it to you. Maybe show it.
Can you present without the slideshow mode?
Yeah, sure, you can. Yeah. So I wanted to just talk about some of the key issues besides child custody, I mean, parental alienation, because everybody was discussing that. But along with that, there's only one issue. There are many other issues like the parent's mental disorder. So I think Dr. Arun talked about narcissistic personality. There could be issue of relocation where we need to assess is it in the best interest of the child, particularly in terms of schooling, social interaction, etc. The issue of sibling separation. So what we see is that they take two children, they just divide among the parents. But it's not pizza. It's not a piece of cake to be just cut and distributed. Many aspects are needed to assess the siblings' relationship. How would they like to spend it? Would they like to be in the same place or not? Why not? What else? Issue of remarriage or repartnering, because in today's day and age, we clearly see many parents are remarrying or at least repartnering. So we also need to look at the implications of this, particularly in the case of gender, right? So if it's a daughter, I'm not stereotyping, but we have seen that there was a case of child sexual abuse by a stepfather, right? So there could be such issues coming up in case of repartnering. So we have to ensure the safety of the child. Clearly, if it's repartnering, we have to reconsider living arrangements and custody arrangements. So these are some of the issues. And, as I already said, states like Maharashtra have this very good family court system. Is there anyone here from Maharashtra, from Mumbai? Anyone
I'm
from
from Maharashtra only. I'm from
there?
Maharashtra
Who's the?
only, and I'm Arun here.
Arun,
I'm
sir.
from
Okay,
Maharashtra,
okay.
and
Oh,
but
okay.
I'm
So,
having
so there are
very
no,
bad
I heard
experience.
because they have family court counselors, no? So did they do any assessments, the family court counselors? Because on paper,
Actually,
they are doing.
in my court there was no counselor for 1.5 years, and when she came, then only our visitation came to routine in the court in presence of that counselor. And
Yeah.
I had discussed that issue with her, but she says you have to present these facts in front of the judge, not in front of me. I'm just a counselor. Unless and until she says
Yeah,
to go through the depth, I will not be able to do that.
correct. So again, this is
This
the
is the
lack
thing.
of legal jurisdiction for the family court counselors in India. But on the contrary, if you look at Western literature, particularly in the American context, someone called it child custody evaluators, they have complete autonomy to decide the living arrangement of the child,
Yes,
the
yes.
custody arrangement, through the various assessments.
Actually,
So
yeah,
through my thesis, even in my whatever work I've published, at the end, I always want to bring up that part where there is a need for these systematic assessments. That's what I want to highlight. But there's still a long way to go in terms of policy reformations where we can bring about these reforms in the court system. We are starting by sensitizing. Right now, we have done a lot of sensitization with judges. We are trying to, I mean, at NIMHANS, we are doing all of that. So I think NIMHANS is continuing to work on this area. And hopefully, we will come to a space where there will be child custody evaluators qualified. I want to highlight qualified child custody evaluators appointed for this work. So, just to tell you why this whole issue of child custody is important in the context of child protection. So, as a social worker, why this topic was important for my thesis was because this is a problem of child protection also. If there is child sexual abuse, if there is child punitive parenting or child physical abuse, we can say, okay, this is a child abuse scenario. right? Child needs to be protected. But what if the abuse is invisible, like psychological harm, including parental alienation? So, high conflict custody disputes, the child is exposed to this emotional manipulation. One parent may attempt to turn the child against the other. So, all of you have talked about parental alienation. So, clearly, it is a form of psychological abuse, right? You can categorize it as that. You're manipulating the child. You are creating loyalty conflict in the child. You're creating anxiety and a lot of long-term emotional harm. So a lot of literature, there's enough literature to say that children who are exposed to this sort of psychological manipulation, like parental alienation, long-term have severe psychiatric um, disorders, right? So many literature has talked about it. There's not yet a systematic review, but hopefully I can work on that. I'm working on another paper, but yeah. So there's also a lot of, so besides the psychological harm and manipulation, there's also a risk of neglect and abuse and exposure to harm. So, intense custody battles may overshadow child's basic emotional and development needs. I already told you, the child's developmental needs like wanting to go to the picnic, wanting to go to a best friend's birthday party. All of this may be denied. That is that is abuse, right? You're denying the child of the basic developmental needs, social developmental needs. That is abuse. It goes undetected. So when disputes include allegations of violence or coercion, whatever, child protection systems must intervene. So as a social work professional, I feel it is very much under the purview of child protection because these children, and in fact more in need of child protection because at least in the case of child sexual abuse, right, where this is the non, when both the parents are non-offenders, we see that parents are willing to cooperate with us, parents are willing to help the child in the healing process. But here, the parent does everything in their mind to sabotage our intervention. If we are trying to do therapy with the child, the parent will intervene, sabotage, not bring the child to therapy. So the parents are, I mean, particularly the non-cooperative parent, are doing more harm than in the case of any other child abuse case. So this has to be seen as a form of child abuse where parents are denying access to the child, I mean, of the child to the other parent for no actual justification. In the term of Richard Gardner, he calls it parental alienation. Clearly, this is a case of child protection that requires intervention. So I gave you some examples, but one example I wanted to tell you, I already told you about the example, the child from the foreign country. I want to tell you about joint custody, for example. So in many literature, foreign literature, particularly when I looked at Scandinavian countries, the literature talked about how joint custody children were better than sole custody children. They did a comparison study. But in the Scandinavian countries, maybe, I don't know, it could be different. But what I saw here in the, say, I think I would have seen maybe 15, 16 child custody cases in my 5-year duration as a PhD scholar. But in that, there was only one case which had joint custody. And when I saw that word joint custody, I'm like, oh, okay, so it's a good thing, right? Both parents have custody. But when I looked deeper into what happened to this child, it was a disaster. So let me just, I can't show you the slide, but because let me just tell you about this case. It was a 13-year-old boy in the joint physical and legal custody of his parents. Since the custody order, the child was forced, I want to highlight here, forced to spend equal time with the father and mother. So it's like 3 days with the father, 3 days with the mother, 3 days with the father. So, the child was like one bag being shifted to 2 houses, right? The father, had probably a mental illness, which is undiagnosed. He never used to give permission to the child to attend school picnics or extracurricular activities because he was also the custodian parent, right? So the school required both parents to sign. Only if both parents sign can this poor child attend a picnic or attend an extracurricular activity. So the father was clearly abusing his custody rights. and he was displacing whatever anger he had on his wife on this child. As a result, the child developed symptoms of anger outbursts, irritability, suicidal ideation. They even stopped going to school. So only at the stage when, so this happened for almost 7, 8, 9 months, I think. Only when he was suicidal and he stopped going to school did the court decide, okay, the child needs intervention because he is talking about suicidal ideation. So till then, till the child, started talking or would have maybe even acted on it, we don't know if there was no timely intervention. Luckily, the court referred and we were able to intervene. But what I want to say, this was a 13-year-old when it was 5 years ago, and I recently, saw him in the adult ward. Not 5 years ago, sorry. This was during my PhD, which was 8 years ago. I saw him in the adult ward. It was very heartbreaking to see him again. He admitted. So this is what I'm saying, the long-term impact of the child. He was 13 then when I was doing my PhD. Now he is an adult, maybe 18, 19, 20. And he is admitted in the psychiatric ward for what his parents could not decide or reconcile with. So here, what I want to highlight is, one is of course the court delay. Definitely the court was at fault. Can anyone tell me who else was at fault here for not intervening? Can anyone anybody just tell? So I told you the scenario. Can anyone tell? Of course, the court should have referred right from the beginning. Okay, I understand. But there was also one other stakeholder which did not act, which delayed. I mean, not delayed, actually, that stakeholder didn't even intervene, I feel.
Maybe the school?
Exactly. The school. How can a child be denied of picnics, extracurriculars? So I have a 2.9-year-old. She goes to play school. So when I go up, I'm traveling somewhere, we travel with her. So if I don't send her to school that in 2 days, the teacher's like, why didn't she come? Where is she? You ask those questions, right? For a 2.9-year-old play school. But this 13-year-old boy was not attending sports day, not attending picnics. And the teacher didn't, or the school didn't want to inquire why the child was denied of these activities which are in the best interest of the child. So, sometimes we cannot just blame the courts alone, right? We have to, every stakeholder must be accountable. The courts have millions of other cases. According to, during my PhD, that particular year, 2017, when I started my PhD, it was 8,600 odd cases in the family court that was pending in that particular year. So you can imagine the pile up, right? Just our family court of urban Bangalore. So such large numbers. But the class teacher failed, right? The mother allowed this to happen, right? So everybody, I mean, the system has failed this child. I would just clearly say that it's not the mother or the father. As a child mental health professional, we are only looking at how the child is affected. And we are only here to advocate for the child's rights. Like I said, we have to be, so, parents' battery, somebody just mentioned, just like the court takes up parents' battery and becomes the guardian, I think mental health professionals, child mental health professionals, or pediatricians, or whoever, when you see a child, when you see a scrawny child, malnourished, have a brief interview. Maybe you can leave the door open if you got a male and that is a girl. Okay. But have an interview alone. We can keep the door open and let the parents sit at a distance, can see you but not hear you. Ask, what's happening at home? That one question may lead you to help report a case of child neglect. It could be a case of marital discord, or this could be a case of intact household where the child abuse is happening. But whatever, we must inquire. We must always try, if we suspect any form of abuse. Let's take some time and ask the child alone, interview the child alone. If the child is 7+, clearly the child can articulate. We should never undermine the abilities of children. I interviewed a child who was 4 years old also. Children are, more capable than we think. So never undermine just because child is 4 or 5. If they can talk, if you see something odd, even if you are not able to, at least refer the parents, say, okay, I suggest you should also visit this person, right? So try to bring up some sort of assessment at a brief level. If you are not able to, at least give a referral to see how else can we help this child. So I'm sorry, I think I exceeded time, but I will share my contact details with Dr. Natish, my email ID. If anyone wishes to email any questions, you may. So I'll just end.
I'll share it.
Yeah. Sorry, my slides stopped.
Ma'am, just one last question. If you can just give a short answer.
Sure, sure.
Ma'am, what kind of arrangement do you recommend under shared custody? Is it 1 week or 10 days, 15 days? What would be your suggestion?
No, yeah. Like I said, I mean, I know Natish sir introduced me as an expert, but just by doing a PhD doesn't make me an expert, I believe, because I would say from all the literature that I've reviewed, the understanding is from literature, foreign literature, gives you a very skewed understanding of this concept, because all the foreign literature I read talked how good joint custody is. But I believe it's not about 1 week with a parent or 3 days with a parent or 1 month with one parent and 1 month with the other parent. It is open access, undenied, unrestricted access for both the parents to interact with the child and co-parent the child. I think the essence of joint custody must be that. The essence of joint custody is how can we co-parent our child together. The child may choose to stay 3 days with Papa and say, no, you know what, I have basketball practice this week, I'm not coming. It's okay, beta, you carry on. That sort of openness, right? But this sort of openness will not come if two parents are, keeping the vengeance, keeping score, and saying 3 days up, next 3 days mine. No, I mean that is the problem. So it is a double-edged sword. If the court says joint custody and the court says 3 days here, 3 days there, that will create a problem, because if the parents are not going to co-parent, support, cooperate as parents, I always highlight, you are not couples anymore, but you will be parents forever. But if they're not willing to take up that cooperative co-parenting stance, I highly recommend the court does not give joint custody, because then, like what happened to this boy, the boy I saw 8 years ago as a 13-year-old, who still comes to Nimhan as an adult, that would be the situation. So it is clearly has to be only after thorough evaluation, because joint custody once given, parents like this will definitely misuse their power, unfortunately. Dr.
Actually,
Santosh,
Yeah, one question, just shortly. See, how do you foresee like a hailing father? Okay, so what he thinks, I speak with a person, he has this perspective, even just to put you, as you have been into this field, like if we let the child to be happy, like rather pulling her for a 2 days here and 4 days with the mom and making her fight and making her intentionally make it that thought like they are separated. So what if, as a father, right, I'm thinking wherever my child is there, let her be happy. Whether it be a mom that she say that father has died or he's not away, or let him show other father. So will this mindset make the child be in our own way, or rather enforcing, hey, there is a father and he is separated and both are separated and we need to show love to each one of them? So what mindset makes the child a better person? To know that the father is not there, is not alive, or I don't know about that father. Yeah, I'm there is other father there. so my life will be happy, or I can be concentrated. Rather, this is quite contradictory, but I want to ask that this is in my mind. So I'm asking how my child will be thinking that, hey, I have a better life. So into the chaos, or just thinking like, okay, my father is not there. This is my life. I'll accept and go. So which will make her a better person? This is my question.
Yeah, I think it's a very difficult question for me to answer, but from the literature review, if I look at sole parenting and I mean children raised in households with both the parents versus single parent. I mean, let me just tell you from that perspective. Literature has clearly shown that children raised in single parent households have higher emotional and behavioral issues than children raised in households with both parent or intact households. Right. So I think Santosh, I'm answering that question in my own way. From my understanding is that children need both parents unless the other parent, whoever you are, restricting the child or cutting the child off, is actually an abusive parent. Unless and otherwise, no child must be denied of their parents. I know the parent could be maybe somebody who is having some form of addiction, maybe somebody
Actually,
with mental illness.
joint
But
custody is
no
possible.
child must be denied of the other parent unless and otherwise this parent that we're talking about is an abusive parent. Yeah. So literature has also said that single parent households, I mean children from single parent households have higher emotional behavioral issues as compared to children from intact households. So a household is in that context, but what I mean is having access to both parents is definitely ideal for a child's upbringing. If there are two parents, I mean, now in today's day and age, we have single, unmarried people adopting children. That's a different context. But if you actually have another parent, denying the access is not in the best interest. Yeah. So with that, Dr. Natish, can we conclude? I have shared my email ID.
Yeah,
And I think Dr. Natish has shared my Christ email ID, but I think the other email ID is also fine.
Yeah.
Please send me any doubts if you have, and I'll be able to respond if it's in my scope of.
Thank you so much, Dr. Priyanka. It was quite enlightening for everyone, and it's quite good for everyone to ask you the question directly because it's a critical one and you handle well also. Thank you so much. Thank you, everyone. So we'll be meeting you in the other session on Alienation.
Good night, everybody.
And thank you for arranging the session. Thank you so much for giving your time.
Thank you. Thank you. Bye-bye.
Thank you,
sir.
ma'am.
Thank you.
Thank you,
Thank you,
Natish,
ma'am.
sir.
Thanks, ma'am.
Thank
Thank
you.
you,
Thank
sir.
you,
Natish, sir.
Nitesh.
Yes.
Thank you, Priyanka.
Very informative session.
Thank you.
And Natish, sir, I will call you.